Yes, good evening all. Hi, hello everyone. Am I audible? Am I audible, guys? Yes, Bima, how are you? How are you, Bima? How is your preparation going on? Charan, Malini, so how is the preparation going on? How was your paper, Physiology 1? Yes, Malini, Charan. Okay, so good, Bima. So good evening all, Sayan Mandal. Sayan Mandal. So Physiology paper 1, easy, right? So many questions came from our lectures, especially offline students. So almost 95 to 96% repeats from the concepts we discussed in our class, especially from the grand test and the weekly test. Yes, Charan? Charan? Shashank? Manthan? Are you there, Manthan? Pratik? Syed? Okay, Sayan Mondal. Okay, no problem. No worry. Yes. So now let's start physiology paper 2, the most expected short essays and long essays. So we are conducting two sessions, today one session and tomorrow one session. Okay, so let's start. So shall we start? Okay, all well? Yeah. The physiology 2, I think it is a bit difficult than physiology 1, I feel, because the CNS part. The CNS part is a bit difficult than other topics. That's why. So I think you will get 50 plus. 50 plus. Yes, Malini, can you just name the repeats from our classes? Repeats from 2 hour classes. I think there are few direct repeats. Direct repeats, especially in RS4, RS5, RS6. Yes, Shashank. What is your opinion about the number of question asked in your exam from our classes? Offline classes basically. The grand test. As you know, we conducted many grand tests. We conducted almost 40 plus weekly test. Right. RS4 and RS5, RS6. Almost 95 repeats from our classes. Yes, Malini is telling, sir, iron deficiency was the question asked in the exam. Okay, that is from the class. Okay, Shashank is telling, sir, 90%. Around 90. Okay. Around 90. So only 2 questions were different. So in actual exam of RS4 and 5 and 6, around 90 and above 90 repeats as per Shashank Pujar, our offline student. Basava Jaigur, sir, paper 2 also. Okay. And RS7, okay, clotting mechanism, okay, intrinsic pathway, I think. So we discussed in last class, so intrinsic pathway, extrinsic pathway, common pathway. So in all, yes. Swami Vivekananda, sir, I am Prashant GR. I got 90%. Okay. 90% repeats. That's great. That's great, Swami Vivekananda. Prashant. Prashant, okay. Okay. So let's start. So the most important question that can be asked in your Physio 2, that is your RGUHS exam. So let's start now. So the first question, my prediction is, okay. Thank you. Thank you, Prashant. Nice. Neural regulation of respiration. So we discussed in class apneustic center, pneumotoxic center, dorsal medullary, ventral medullary, Bitot breathing, Kussmaul breathing, है ना? So all this question came. Cerebellum. Okay. 70% same question, no twist and turn. Shashank, nice. Charan, okay, fine. Now let's start. So in paper 2, so one question commonly asked, that is little brain, that is the cerebellum. Cerebellum is known as little brain, present in the posterior cranial fossa. Okay. So one very commonly asked question is, what are the functions of cerebellum, and what are the functional divisions of the cerebellum, and very important is cerebellar disease, especially RS7 students. This can be clinical based question. So okay, this is the question asked in the exam. List out the functional division of cerebellum and a note on cerebellar dysfunction. So what are the functional division? Can anyone answer? What are the functional division? Yes, guys. Can anyone answer? There are three functional division, right? What are three functional division? So Danish, okay, Dora, okay, that's okay. So let's see. There are three that I'll let you know, Prashant. You don't worry. Now listen to class. Later we'll have discussion. We have a lot of time after exam. We will discuss everything. Okay, don't worry. Now Physiology 2. Concentrate on Physiology 2. Concentrate on all 40 questions which I'm going to discuss in today and tomorrow class. Okay. Yes. So Malini is telling, sir, spinocerebellum hota ek. So one is spinocerebellum. So that is basically for posture. Okay, sitting posture, standing posture, all this, right? So spinocerebellum, that's okay. Then comes is the archi and neo, fine. Vestibular cerebellum, okay, vestibulocerebellum, and one more is there. What is that? Corticocerebellum, very good. So there are three subdivisions. So what you can write here? Corticocerebellum. So corticocerebellum, cerebellum. That is the one point. Second, spinocerebellum. Spinocerebellum. Then one more is there, that is basically vestibulocerebellum. Vestibulocerebellum. So the mnemonic is CSV. CSV is the mnemonic. So all of you write CSV in the chat box. CSV. So basically, a cerebellum is for coordination of the movements. The basal ganglia is for initiation of the movements. The cerebellum is basically for coordination of movements. Like example, batting, है ना, 4, 6. So batting, everything, coordination, eye coordination, eye muscle coordination, है ना. So that is basically because of cerebellum. Cerebellum is very important for the coordination. Remember, when cerebellum is damaged, there will be incoordination. So incoordination can be seen in various conditions, even drunken gait. So it resembles like a drunken gait basically. CSV. So all of you write CSV. आपको लिखना पड़ेगा. So you can interact with me. So you can keep me awake. You can keep yourself awake. ठीक है? चलो. Next. So ये हो गया. So now this is okay. So this is what I said. So this is the little brain I said, present in the posterior cranial fossa. Now here one more question asked. What are deep cerebellar nuclei? 3 marks question. Deep cerebellar nuclei. What are the cells of cerebellum? Which are stimulatory, which are inhibitory? Very commonly asked. Let's see. Let's see. So this is what taken from the standard textbook. This you need to write. So vestibulocerebellum, spinocerebellum, corticocerebellum. So vestibulocerebellum includes flacculonodular lobe, which forms archicerebellum. Spinocerebellum basically involves lingula, central lobe, culmen, lobulus simplex, declive, tuber, pyramid, uvula, and others. We can write this. Corticocerebellum basically lobulus ensiformis and lobulus paramediacus. Can anyone identify the name of the textbook? This textbook? Hmm? The reference? Yes, come on, guys. What is the reference? Which book textbook is this? Okay. Let's see. Charan? Yeah. This is taken from Shambulingam. Okay. So this you need to write few points about this. Then you need to write this diagram. So this is very, very important diagram. Very commonly asked. What are these cells? So stellate cell, basket cell, Purkinje cell, Golgi cell, granule cell, glomerulus cell. So there are many cells. So mossy fiber, parallel fiber, and there are three layers: granular layer, Purkinje cell layer, molecular layer. So this is very, very important. And the climbing fibers. So and all you need to mention in the exam. This is very, very important diagram. All of you concentrate this. Shambulingam. Yes. So this is taken from Shambhu. Fine. Check it. Now look at this. What are the interneuronal activity in cerebellum? So I said already climbing fibers. So climbing fibers acts on the Purkinje cells and cerebellar nuclei. The action is excitation. And what is the neurotransmitter? Aspartate. Remember, whenever word aspartate and glutamate, they are stimulatory. Whenever word GABA is there, that is inhibitory. Okay? So mossy fiber, so basically cause excitation, which act on the granule cell, Golgi cell, cerebellar nuclei. Then granule cell, stellate cell, basket cell, all this you need to write. Remember, so these two are basically stimulatory. So you can see the GABA here, Purkinje cell, Golgi cell, basket cell, stellate cell. All these are basically, they are basically inhibitory. This is asked as a MCQ. Okay. So can anyone tell me which is the excitatory, which has excitatory action among this cell? Go through this table and try to answer. Among this, which has excitatory function? Which cell has excitatory function? MCQ. Very commonly asked. Guys. Try and you answer. Then you need to write about so components and connections of functional divisions of cerebellum. This is very important. So what are the components? What are the connections of the cerebellum? So divisions already we discussed. CSV. Yes. Now what are the components? You need to write this. Then the afferent connections. So what are afferent connections and what are afferent connections? So this is what important in physiology. So you need to write about afferent connection and afferent connection and the components and the divisions. So if you write all this, you will get definitely 7 marks in the exam out of 10. So granule cell, very good. Granule cell. Okay. So this is fine. Now comes is what are the functions. So the functions basically regulation of tone, regulation of muscle tone, the posture, regulation of the posture and equilibrium. And I said already, it's very important for coordination of the movements. Coordination of the movements. 2 important functions. Now comes is your what are the cerebellar signs? So I think we discussed in anatomy class, the mnemonic is Danish. So D for dysdiadokinesia, D for dysmetria. So dysdiadokinesia is the inability of the person to do rapid alternate movements. So dysmetria is the inability to judge the distance. Then comes is ataxia, that is basically imbalance. Then nystagmus, which is horizontal nystagmus, intentional tremor, slurred speech and hypotonia. Remember hypotonia, it is not hypertonia. So all of you try and all of you write the mnemonic Danish in the chat box. Right, Danish, all of you. Malini, everyone, right? Danish. So Danish. Okay. So this is commonly asked. Next, what are the deep cerebellar nuclei? And we discussed in anatomy class, cerebellar nuclei. The mnemonic is don't eat greasy food. D for dentate nucleus, E for emboliform, G for globose, and F for fastigial nucleus. So this is also very important. Again, all of you write in the chat box the mnemonic. Don't eat greasy food. Dentate, emboliform, globose, and fastigial. Write this in chat box. Renuka Babu Rathod, others, keep writing. Keep writing, guys. Keep writing. Yes, Charan. Good. Charan. Good. Chal. So the next question. Now look at this now. So this is one very important finding in cerebellar lesion. Can anyone identify what is this finding which is visible in the image? DFG is also good. Okay, NEET online. DFG is also good mnemonic. So don't eat greasy food. That also it's a good mnemonic. What is this finding? Renuka Babu, Malini, Shashank Puja, NEET online. NEET online. Can you tell me what is this movement? What is this movement? What is this movement? I'm showing like this. What is this movement? That occurs in case of cerebellar disease. Yes, thank you, Prasha. Thank you, Praveen. Praveen BS. So great to see. Praveen BS and yes, Swami Prashant GR. Thank you, Praveen and Prashant. Yes, chalo. Can you tell me what is this finding known as? So there are two important signs. One is a Romberg sign. Romberg sign. So Romberg sign is very important. The second one, what is this finding? Finger nose test. Okay. So this is finger nose test, right? Finger test, finger nose test and all. What is not finger nose test? This is something else. What is this? No, let's see. Hypotonia. Okay, hypotonia. Rebound phenomena. Okay. So all of you remember rebound phenomena. Rebound phenomena. Okay, rebound phenomena. So this is one important finding. Then one more important finding. What is this can identify? I think this you can identify. Inability to do alternate rapid movements like this. What is that? What is that known as? Come on, come on. Sahil, Yashwant. Yashwant. What is this movement? Come on, jaldi batao. Yes, yes. Keep writing, guys. Keep writing and keep answering. You can keep me awake. You can keep yourself awake. Yes, Malini. So Malini answered correctly. So Malini, very good. Sir, this is dysdiadochokinesia. Kinesia. Very good answer. Great. So then we have one more test. One more. Remember, this is a Romberg test. Romberg sign. Romberg sign. So the swaying of the patient upon closure of the eyes. Okay. So that is known as the Romberg sign. Remember, cerebellar sign occur on the same side of the lesion. Okay. Cerebral lesion usually opposite side of the lesion. Okay. Dysdiadochokinesia. That's great. Chalo, this okay. Cerebellum done. So all of you go through this. Okay. So you need to write about all these things. Is it clear, guys? Cerebellum, Malini and others. Clear? Shall I move ahead? So next question is my favorite question. I think this can be asked in upcoming exam. So that is adrenal gland. Adrenal gland, very important. So adrenal gland has adrenal cortex and adrenal medulla. And remember, this is very important gland. The person cannot survive. The human cannot survive without adrenal gland. He might die within 5 to 10 days because of the emotional stress, because of the physical stress. This is a very important gland. So very small gland that is present over the kidney, suprarenal gland, that is adrenal gland. Okay, so yes, so all of you just try to remember, this is what given in your Shambulingam, life-saving gland, life-saving, essential endocrine gland. Death occur within 3 to 15 days due to mental stress and physical stress. So remember, no adrenal gland, there will be death within 3 to 15 days, probably because of mental stress, probably because of the physical stress. So this is what you need to write in the beginning, right? So all of you write adrenal gland is equal to life-saving gland. Life-saving. Keep writing, all of you. Keep writing this. Keep writing. Life-saving gland is equal to adrenal gland. So master gland is pituitary, and this adrenal gland is life-saving gland. And this has, as I said, it has a cortex and it has a medulla. Cortex and the medulla. So now let's see what are the divisions of cortex. What are the divisions of cortex? So the mnemonic is GFR. GFR. Can you tell me, all of you, what is GFR? So what are the subdivisions of cortex? Can you just tell me, anyone? What is G for? What is F for? And what is R for? G for glomerulosa, F for fasciculata, and R for reticularis. R for reticularis. Okay. So G for glomerulosa, fasciculata, reticularis. And the medulla secretes, that is basically epinephrine and norepinephrine. Epinephrine, norepinephrine. All of you write cortex is equal to GFR. GFR, okay, not the kidney GFR. Remember, it is GFR. Glomerulosa, fasciculata, and reticularis. Write this, all of you. GFR, right? Yes, keep writing, guys. Keep writing GFR. Just write GFR. Now let's see what is the function of glomerulosa. So glomerulosa basically for the salt, you know, it secretes aldosterone. It secretes aldosterone. So aldosterone basically for what? Absorption of sodium, salt. Then fasciculata and reticularis, right? So GFR you write. Then let's see from this you can write in the exam. Okay. So that is salt, that is zona glomerulosa. Sugar, that is the basically glucocorticoids, that is the zona fasciculata, and androgens, we call it as sex hormones, that is basically reticularis. So I can see here salt, sugar, sex. Salt, sugar, sex. Remember, sex means sex hormone. Okay. So all of you, once again you write. So cortex is equal to salt, that is basically absorption of the sodium, and that is aldosterone. Then comes is your sugar, that is glucocorticoids. As you know, glucocorticoids causes Cushing syndrome. There will be hyperglycemia. Yes. Then that is the sex, that is androgens. Let me write this. Very simple mnemonic. Very simple mnemonic. Keep writing this, guys. Keep writing. Now we are going to discuss about in general. In exam, whenever question asked, main question, you need to write this diagram. So that is superior surface of the kidney, suprarenal gland. Then we have medulla, cortex, and adrenal gland. And this is the adrenal gland. And we can see here zona glomerulosa, which secretes what? Mineralocorticoids. So what is that mineralocorticoid? Aldosterone. Then zona fasciculata, glucocorticoids, basically for what? Glucose metabolism. We call it as steroids. That is basically cortisol, corticosterone, and cortisone. So this is important. Okay, cortisol, corticosterone, and cortisone. Androgens, basically they cause muscularization. So that is basically what? Dehydroepiandrosterone. And also the medulla has epinephrine and norepinephrine. So this is very, very important. So all of you, this is asked in anatomy also. This can be asked in physiology as well. Physiology as well. ठीक है? चलो next. Now comes this Cushing syndrome. Cushing syndrome. So what are the clinical features of Cushing syndrome? Remember, Cushing syndrome is because of increased glucocorticoids. Addison's disease is because of decreased glucocorticoids. So Cushing syndrome and the Addison's disease, they are like, one is because of the increased cortisol, one is because of decreased cortisol. What are the features of Cushing syndrome? You can see here body fat. So as you know, the glucocorticoids basically for distribution of fat. When there is a Cushing syndrome, more hormone, there can be central obesity. Central obesity. So buffalo hump. So buffalo hump means deposition of the fat in the neck area, like this, neck area. Then comes the moon faces, moon jaisa faces. So buffalo hump, moon faces, central obesity. Three important features of Cushing syndrome. Then comes the skin. In the skin, very important is purple striae. So purple striae over the abdomen and flanks. Acne and hirsutism, easy bruising, facial plethora, hyperpigmentation. Musculoskeletal, proximal myopathy. Remember, not distal myopathy, proximal myopathy. Then osteoporosis. So more is the glucocorticoid, more is the osteoporosis. Then metabolic, what happens? Reproductive, amenorrhea, oligomenorrhea. So oligomenorrhea. Then hypokalemic alkalosis, CVS, there can be atherosclerosis. So there can be the symptoms of anemia as well. CNS, it causes depression and psychosis. So very important. In CNS, it causes depression and psychosis. All these are the features of Cushing syndrome. Very, very commonly asked 5 marks question, pakka question. Pakka question. Okay, Charan? Okay, good. Next. Now look at this now. Look at this question. Now this image. Now look at this image. A 20-year-old female having a classical facial feature, facial plethora, oligomenorrhea, and other clinical feature. What is this finding visible there? What is the finding there? What is the finding there? Come on, guys. Come on. Try to answer. What is this finding? Cushing syndrome, okay. Sayan Abdul Rahman. Cushing syndrome, okay. What is the finding there? What is there in the face? Look at the face. Look at the face. Does it look like sun or moon? Okay. Charan, what is this known as? I want that word. What is that word? Come on, guys. Come on, try. Try. Sayed, this is basically moon faces. Moon face. Cushing syndrome, moon face. Then look at this image. What is the finding there? What is the finding there? I said already like this. Like this. What is this? Come on, guys. Keep answering. So this is basically, what is that? Buffalo hump. So buffalo hump. Buffalo hump. Okay. So what about this? This finding in Cushing syndrome? Cushing syndrome, Sayan. What is this finding? Very good. The first two answer is again Malini and Syed. Okay, very good. Syed answered. That's great. Syed, good answer. So what is this basically? You can see abdomen there. You can see the easy bruising there. Easy bruising, and there is one more striae is there. What are they? Purple in color. What is this? Purple striae. Okay, they are basically purple striae. Okay, good. So this is very important question. You can go through this again. All of you, this can be a clinical based question in your exam, upcoming exam. Buffalo hump, purple striae, thin limbs. Limbs are thin. Proximal myopathy. Then thin limbs are central obesity, facial redness, facial plethora. So this would be Cushing syndrome. Cushing syndrome. Because of what? Increased cortisol. Increased cortisol. Okay? Purple striae, that's great. Chalo. Next. Now one more important question. Addison's disease. So whenever question asked in exam, so write about Addison's disease. So in Addison's disease, remember, bronze pigmentation. So what are the clinical feature? Mnemonic is Addison. Addison. A for appetite loss. No hungriness, no hunger. ಊಟ ಬೇಡ ಏನು ಬೇಡ. Weight loss, ತೂಕ ಕಡಿಮೆ ಆಗುತ್ತೆ. Darkened skin, I said, bronze pigmentation. Dizziness, irritability, salt craving, hyponatremia, orthostatic hypotension, nausea, vomiting, abdominal pain. This is because of the Addison's disease. Addison because of decreased secretion, and Cushing is because of hypersecretion. So this very, very important. So Acha. So Malini is telling sir, kai kalu sanna hotte dumma. Okay. Kai kalu sanna hotte dumma, Cushing syndrome. It can be diabetes mellitus also. Diabetes also same. So kai kalu sanna hotte dumma, central obesity. Diabetes also it can be seen. Okay, that is great. Okay, that's fine. Chalo. Now, okay, this is done already. Okay, now all of you look at this now. This is something related to adrenal gland. What is this condition? So this lady is having, there is a finding there. Okay, what is the finding there over the face? Look at the face now. So happy looking face, she's smiling, but look at the face, there is something is there. What is the finding there? Come on guys, come on, try. Come on. Malini. Addison. Why Addison? Because of what? Because of that is pigmentation. So I said bronze pigmentation. Remember bronze diabetes, that is hemochromatosis. So this is bronze pigmentation. Okay, that's okay. Sure. Second question, okay. Now one more, regulation. Regulation important. So we have hypothalamus. Who is the CEO. Okay, hypothalamus is the CEO. CEO matlab boss hai. Okay, big boss. He is a big boss. You know, big boss. So what he will do? He will send CRH. CRH go. CRH will go stimulate pituitary gland. So pituitary gland, master gland. So what he will do? He will secrete ACTH. So ACTH secreted by interpituitary, and ACTH will go to our worker adrenal cortex. So adrenal cortex will secrete glucocorticoids. And finally, what happens? Negative impulse goes to hypothalamus, pituitary, and 2. So this is not a negative feedback mechanism. Okay. So pigmentation because of increased ACTH. So write this in chat box. So pigmentation is because of what? Increased ACTH. So this is the concept you need to know. Hypothalamus is like a CEO. He's a boss. So he's the boss of many nuclei. He has many nuclei. He will control everything in our body. He's like a boss. He is our head. Okay. Negative feedback. You know, Malini? Good. All of you understood? This is okay? Chalo. Okay, guys. So, okay, guys, are you enjoying the class? Are you enjoying class? So, shall I teach in this way or in very serious way? Very serious kind of way. Usually the professor do no very serious kind of teaching. That kind of teaching you want, that also I can do. Or this funny way, if you want, I can teach in both the ways. Okay? Anything, any suggestion from your side? Two questions over. Now third question. चलो Syed Abdul Rahman, pigmentation due to ACTH. ये समझ में आ रहा है, ठीक है ना? So which is better, serious way or some fun in between, like these images and all? अच्छा, serious way. You want see? Nazba is telling us a serious way. चलो ठीक है, serious में पढ़ाते हैं आपको. This is nice, sir. Okay, this is also okay. Now, chalo, in between we will have some fun. So name the nuclear basal ganglia. Basal ganglia, very important. Explain the functions of basal ganglia. I think we discussed in anatomy class and Parkinson disease. Okay. So basal ganglia is a group of subthalamic nuclei. You can see there are many nuclei are there. So what are the nuclei of basal ganglia? And also remember, okay. So you can see here this image. Don't forget this image. So basal ganglia is like a gatekeeper. You know gatekeeper. So gatekeeper usually present outside the hospital, outside the clinic. He is like a gatekeeper. So basal ganglia basically for what? Initiation of movements, and also he will control the movement basically. So let's see basal ganglia. So basal ganglia basically he is a motor control center. So motor control center. He is also known as gatekeeper. He is a gatekeeper basically. So he also helps in refining of the movements, and also helps in reward, aggression, movement, and also incorporating adaptation and incorporating habits and behavior. So it has many functions. So basal ganglia has many functions. So all these are the basic functions of basal ganglia. So this is commonly asked in the exam. So all of you try to remember. All of you write in the basal ganglia. Basal ganglia is equal to gatekeeper. Write this in chat box. Chalo. Okay, seriously. Okay. So you are Gen Z, no? They like fun. They like fun way of learning because exam is their physiology. That's why the people are asking me to teach in serious way. But I'll try my level best. So to deliver. So Malini, all of you write. Basically is equal to what? You write gatekeeper. Right? Gatekeeper. Keep writing. And functions also you can see here. There are easy functions are given there. You can remember this. So 1, 2, 3, 4, 5, 6 is like that. You can write. Functions of basal ganglia. The first one, motor control center. Second one, reward. Third, aggression, movement, planning, incorporating habits, adaptation, behavior. So good habits, bad habits. All this because of your basal ganglia. So that is very helpful in. Okay. So gatekeeper, Malini, Nazba, Tanya, excellent. That's great. So don't forget. So this image, all of you. This image gatekeeper basal ganglia. ठीक है. CEO hypothalamus. So now let's see what are the nuclei and what are afferent and what are efferent. So this is very important. This is taken from Shambhulingam. After the class, go through this. So corpus striatum, substantia nigra, and subthalamic nucleus of lice. So the three important components. Remember, this is my favorite. This is my favorite, substantia nigra, because it is involved in Parkinson disease. So what are afferent connections? What are efferent connections? Afferent you can write. So all this you can write. Keep writing, guys. This all important. And so globus pallidus, all this you can write. Nucleus and all. All these are important component. Okay. You can go through the Shambhulingam. Now Parkinson disease, very important clinical question. So Parkinson disease very commonly asked. The mnemonic is be smart. So B for bending forward, like this bending forward, like this bending forward. Okay. Then shuffling gait, mask-like faces. Look at the face, mask-like faces. Akinesia, bradykinesia, difficulty in initiation of the movements. Then rigidity. So there can be tremors. Remember tremors, resting tremors. So Parkinson, all of you write be smart. Parkinson is equal to be smart. Keep writing. Be smart, guys. Be smart in learning. Be smart. So what happens in Parkinson disease? There is a deficiency of dopamine. So in the substantia nigra. So because of that, all this is going to occur. The treatment is levodopa. Levodopa is the treatment. So levodopa is a pro-drug which is given along with the carbidopa. So carbidopa. So this is question asked in our biochemistry. So what is the rationale of giving levodopa along with the carbidopa? So remember, this is a drug that is given in Parkinson disease. Be smart, Nazba, very good. Be smart. Good, great. Chalo. Okay, Parkinson, okay, done. Basal ganglia, done. Next. Now, what is this basically? Can anyone tell me something related to basal ganglia? There is one disorder characterized by dancing movements. So like this dancing movements. So what is this known as? Can anyone tell me? What is this dancing movement? Sharan, Malini? Yes, come on, come on. Treatment levodopa along with the carbidopa, Nasba, very good. Excellent. Okay. What is this known as? Huntington's chorea, Cyan Mandal, very good. Cyan Mandal is telling sir Huntington's chorea. Huntington's chorea. Or Sydenham's chorea. Sydenham's chorea. Sydenham's chorea seen in acute rheumatic fever. Huntington's chorea is a condition where there is a involvement of the basal ganglia. There will be dancing movement, I said, like this dancing movement. Okay, so this is what you need to write in the exam. Huntington's chorea, Huntington's disease. Great. And also one more, hemibalismus. So hemibalismus. So don't forget hemibalismus. Okay. Parkinson disease, hemibalismus, and one more is that is Huntington's chorea, Sydenham's chorea. You can write this. So examiner will be very happy. Okay. So that's okay. Done. So basal ganglia done. So next question. Next question is about thyroid gland. So thyroid. Paper 2 full of thyroid. Pakka question in upcoming exam. Thyroid. So as you know, T3, T4 secreted by the thyroid. TSH is secreted by the pituitary gland. Okay. So what happens in hypothyroidism? Hypothyroidism. What happens in hypothyroidism? So there will be increased TSH, decreased T3, T4. So what happens in case of hyperthyroidism? Hyperthyroidism. Can anyone tell me what happens in hyperthyroidism? So decreased TSH, increased T3, T4. Increased T3, T4. So this is very important. So Malini is telling sir cold intolerance. So cold intolerance occurs in where it occurs? So cold intolerance occurs in case of hypothyroidism. Very good. Heat intolerance occurs in case of heat intolerance. Heat intolerance occurs in case of hyperthyroidism. Why? Because T3, T4, they are involved in BMR, basal metabolic rate. That's why. Okay? So this is very important. You can write one diagram also in exam. So right lobe, left lobe, isthmus, endol, tracheendal, you can write. So midline structure. So this is what important. Now, what are the functions? You need to tabulate 10 functions at least. 10 functions. I'm going to say fetal brain development. One important function is fetal brain development. Can anyone tell me? So T3, T4 is very important for formation of the fetal brain. Say example, hypothyroidism. Neonatal hypothyroidism. What would be the complication? Neonatal hypothyroidism, what would be the complication in the baby if it is untreated or undiagnosed? What happens? What happens, Nazba? Come on. Try. Serious complication, all of you guys. Serious complication. Remember what happens? What happens? Come on, guys. Come on. Cretinism. Okay. What is the important complication? What is the important complication? So there is mental retardation. Okay. So if you remember mental retardation. MR, that is mental retardation. Okay. So there can be cretinism is child, thyroid dwarfism and also pituitary dwarfism. Both are important question. Pituitary dwarfism and thyroid dwarfism both are important. Okay. So okay. Then skeletal maturation that will be affected. Increased BMR, yes. BMR is because of the thyroid hormone. Inotropic and chronotropic effects. Inotropic and chronotropic effects on the heart. So my question is, what happens to heart rate when there is a hyperthyroidism? What happens to heart rate when there is a hyperthyroidism? Heart rate. Chalo batao. Malini, very good. Keep writing. Keep answering, guys. Keep answering. So what happens to heart rate in hyperthyroidism? Hyperthyroidism can be primary and secondary. So, there will be CNS involvement in hyperthyroidism. There can be heart involvement also. So, there will be increased heart rate. There can be high chance of BP as well. So, that is what important. Then, increased sensitivity to catecholamines. Stimulate gut motility. This is also very important. Constipation occurs in hypothyroidism. Diarrhea occurs in case of hypothyroidism. So, hyperthyroidism. Bone turnover. So, that is also affected by thyroid disease. serum glucose. So hyperthyroidism can lead to diabetes mellitus, as you know, and decrease in serum cholesterol. So serum cholesterol level increase in case of hypothyroidism. Then conversion of carotene to vitamin A. Then also it has very important role in thermal regulation. So all these are 10 important functions you must mention in your exam answer sheet. Yes, Charan, can you able to write? Can you able to write all the 10 functions? Say yes or no? Say yes or no, Charan. Just mention this 10 important ones. 1, 2, 3, 4, 5. At least 10. 10 important functions. 10 important functions. Can you able to write? Yes, so Nazba, very good. So decrease HR. Chalo. Next comes is your exam hyperthyroidism. You need to write about hyperthyroidism. Clinical based question. So all of you first year student, RS7 students, clinical based question can come from hyperthyroidism. Let's see what are the features of hyperthyroidism. So intolerance to heat. So you can see here, very interesting image. Fan is there. So every time fan. So why fan? Because intolerance to heat. So okay, hyperthyroidism. Fine straight hair. Okay, that's okay. Bulging eyes. Exophthalmos. Exophthalmos. So eye features are very common because of the deposition of glycosaminoglycans. Facial flushing, redness, enlarged thyroid gland, tachycardia, systolic blood pressure, breast enlargement, weight loss, muscle wasting, tremors, clubbing, diarrhea, menstrual changes, all this amenorrhea can be seen. So all these are the features of hyperthyroidism. We need to mention about 10 important findings. 10 findings in hyperthyroidism, 10 findings in hypothyroidism. Yes. Fan Mandal, okay? Yes, come on. Exophthalmic goiter. That's great. Chalo. Then hypothyroidism. So you can see hypothyroidism fully packed. Okay, fully packed. Intolerance to cold. ಸೊ ಎಲ್ಲರಿಗೂ ನಾರ್ಮಲ್ ಆಗಿರುತ್ತೆ, ಅವ್ರಿಗೆ ಮಾತ್ರ ತುಂಬ ಕೋಲ್ಡ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ದಟ್ ಓಕೆ ಫ್ಯಾನ್ ಆಫ್ ಮಾಡಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಓಕೆ, ಸೊ ದೇ ಆರ್ ಹೈಲಿ ಇಂಟಾಲರೆಂಟ್ ಟು ಎ ಸಿ. AC, traveling in AC cars, AC buses. So you should think about probably hypothyroidism. Hypothyroidism is very common nowadays. One of the common cause of infertility as well. Infertility because of amenorrhea. Yes. So all of you, intolerance to cold, that is hair loss, edema, then all this occurs, anorexia, menstrual abnormalities, subnormal temperature, bradycardia, weight loss, thickened skin. So one more important feature is thickened skin. There will be hyperkeratosis. When you see the palm skin that is thickened, hyperkeratosis we call it as. Then hair loss, apathy. Apathy means no interest. Okay, no interest in the work, no interest in the feelings, no feeling at all, nothing. Lethargy, always lazy lethargy, no work, nothing. Then dry skin, we see, when you see the skin, dry skin, tumma dry and such feel. Muscle aches, weakness, constipation, very important is constipation. So constipation. Then all this occurs in case of hypothyroidism. So all of you write in the chat box, in hyper. So in hyper, what happens? In hyper, there will be diarrhea. So there will be diarrhea and heat intolerance. Heat intolerance. So write this in the chat box. And hypo, you can write in the chat box. So there will be constipation. So there will be constipation. There will be cold intolerance. Cold intolerance. Keep writing, guys. Keep writing these 2 points. So because these are very important, in exam the question asks difference between hypothyroidism and hyperthyroidism. Pakka question coming upcoming exam. Keep writing. Okay. Keep writing. Malini, keep writing. Everyone, keep writing and keep answering. Okay, Syed Abdul Rahman. Good. Good. Okay. So cold and Charan. Okay. So fine. Next. Now look at this. Now one more important image-based question from thyroid gland. What is this basically? Look at this now. Look at this. What is the finding there? Anyone tell me? Neck swelling is there, which moves with the deglutition. Okay. What is this? The one of the commonest causes Hashimoto thyroiditis. It's autoimmune condition. So there can be one nodule. There can be multiple nodule. What is this condition? Neck. One of the causes iodine deficiency. What is this condition? Come on, guys, come on, try to answer. Goiter, very good. First to answer is Malini. Sir, this is goiter. What is goiter? Enlargement of thyroid gland. What are the causes? Autoimmune diseases like Hashimoto thyroiditis or iodine deficiency. It causes hypothyroidism. There can be hyper also in the beginning. Later it can be hypothyroidism. So lifelong treatment is required. A levothyroxine required. So that is thyroxine every day. So 50 mg, 75 mg, 100 mg, 100 microgram basically every day required. It should be taken before food. Okay. So this is goiter. Then comes is now one serious condition. Very serious condition. Because of the deficiency of thyroid hormone. You know, thyroid hormone is very important. T3, T4 is very important. When there is a serious deficiency, what happens? There is one condition. What is that condition known as? Can anyone tell me what is this condition known as? So there can be encephalopathy as well. Very serious condition. It's a crisis basically. What is this crisis? Because of deficiency of thyroid hormone. Nazba. Nazba, come on. Come on, come on. Keep on answering guys. Keep on answering. Syed Abdul Rahman, Nazba, come on. Keep on trying. Goiter, he goiter nahi hai. Edema, you can see the edema there on the face. There are some CNS feature, tremors. What is this condition known as? This is known as myxedema. Okay, myxedema. So all of you, this can be a question in exam. Myxedema can be asked. Chalo. This completes your fourth question. Fourth question. Okay. Now fifth question. Fifth question, my prediction, pakka question, menstrual cycle. Uterine endometrial cycle. Very frequently asked. You need to write about the definition. So what is the normal cycle? What are the phases? Can anyone answer? What are the phases of endometrial cycle? What are the phases of endometrial cycle? Let's see. Myxedema. Myxedema. Good. Come on, try guys. Fifth important question. What are the phases? Very simple. Okay. So one is the menstrual phase. Then after that, proliferative phase. Then secretory phase, as you know, very important. So what are the phases of endometrial cycle? In exam, you need to write this one. So menstrual phase. So the first one is the menstrual phase. Menstrual phase. So you need to write about the day. 1, 5, 14 and 28. So 1, 5, 14 and 28. So up to around 4 days, that is menstrual phase. Up to 14, proliferative phase. Because of what? Estrogen. 14th day, there will be ovulation. So ovulation. Then secretory phase. Then there will be up to 28 days. So this you need to write. All these are uterine changes during menstrual cycle. At the same time, you need to write this diagram. So this is a very important diagram of uterus. As you know, uterus has 3 layers: endometrium, myometrium and perimetrium. So all changes occurs in the endometrium. So basically the blood vessels, right? So the basic important hormones are LSH, FSH, progesterone and estrogen. LSH, FSH secreted by the pituitary, and this estrogen and progesterone secreted by, yes, come on guys, ovary, right? Yes, Sahana is answering. That's good. 14-day ovulation. That's great. Prolif secretive and menstrual ovulation. Very good. Good answer. Good. Renuka answered. Excellent answer. Renuka. Good. So Renuka is first to answer. So great answer. Okay. Can you able to write this, Charan? So can you able to write this diagram? Label diagram important. Okay. Label diagram is important in exam. So now what are the hormonal changes? One more. So one more diagram is there from the Shambulingam. You can go through this. Okay. So what happens to the progesterone? Progesterone, estrogen and LH and also FSH. So you need to write this diagram. So one diagram that is showing progesterone. So and this is nanogram per ml. Nanogram per ml. So what you can see here, progesterone, it increases in the secretory phase because it is secreted by the corpus luteum. Okay, corpus luteum. Corpus luteum. As you know, corpus luteum, later it is secreted by the placenta if there is a pregnancy is there. So, right? Okay. So, corpus luteum, progesterone in the secretory phase. So, one is progesterone diagram. So, then is the estrogen. So, estrogen you can see here. So, it is just before the ovulation, there is a peak. Estrogen again, PG. PG means picogram per ml. So, again, 0, 50, 100, 150 and all you can write. Then LH, FSH, you can see LH and FSH. So almost, so the peak occurs at the time of ovulation. So this is very important diagram. So 1, 2, 3, three diagrams showing four important hormone. What are they? Progesterone, estrogen, LH, FSH. What is important here? The labeling is important. So this is menstrual cycle, proliferative phase, and secretory phase. And this is basically international units per liter. And this is 0 to 60. Here it is 50 to 250. Here it is 0 to 3. So this is very, very important diagram. You need to practice. So how many of you read this properly? How many of you read this diagram properly before along with the labeling? Say yes or no? Yes or no? Come on guys, come on. Come on guys, say. Charan, have you read this properly? This diagram? Hormonal changes in menstrual cycle, very important. And the feedback mechanism, very important. Good. Can you able to write, Charan? This diagram? Say yes or no? Say loudly yes sir. Loudly yes sir in the chat box. You can make me happy. Yes sir, I will write. Yes, come on. So Malini haven't read properly. Malini? Yes, Malini, go through this diagram. Very important. No problem. Anyway, you are learning today. That's okay. Before 2 days, before 2 or 3 days before exam. That's great. So next comes is your what is this condition? Now it is now interesting question. This girl basically, this girl, say around 17, 18-year-old, having abdominal pain, headache, lot of headache, nausea is there, nausea, headache, diarrhea. She's also having diarrhea. She's also having mood swing, so extreme mood swing, fighting with the parents, fighting with the brothers, boyfriends, boyfriend. Increase appetite, so increase appetite, abdominal bloating, sensitive, all this. So what is this condition known as? This occurs something related to menstrual cycle in a teenager and having abdominal pain, mood swing. What is that condition known as? Come on, guys, come on, try to answer. Let's see. Done. Sahana, very good. Sahana H, good. What is this condition known as? This is known as PMS. So premenstrual syndrome. Premenstrual syndrome. Okay. Yes, all of you write premenstrual syndrome. Just write PMS in the chat box. PMS. So whenever question asked, menstrual cycle, write PMS and try to memorize this. PMS. Write this PMS. So Nazba Tania, very good. So she answered sir PMS. Okay, that's great. Keep writing this. Then we can write amenorrhea, oligomenorrhea, dysmenorrhea, DUB, dysfunctional uterine bleeding, dysmenorrhea, amenorrhea, menorrhagia. Okay, all this you can write in the chat box. So you can write, so in exam you can write this from the Shambulingam. So after the class you just go through this premenstrual syndrome. So whatever I do teach usually from the standard textbook. You can see a premenstrual syndrome. So what are the clinical features? Mood swing, anxiety, irritability, emotional instability, headache, depression, constipation. So it is given diarrhea there, but in constipation, okay. Abdominal cramping, bloating, and abnormal condition, amenorrhea. So what do you mean by amenorrhea? Absence of menstruation. Hypomenorrhea, decreased menstrual bleeding. Important. Then menorrhagia. So increased bleeding known as menorrhagia. Oligomenorrhea, decreased frequency of menstrual cycle. Polymenorrhea, increased frequency. Dysmenorrhea, dys matlab pain, painful menstruation. Then metrorrhagia, uterine bleeding. So metrorrhagia, this can be a question in your exam. Metrorrhagia. So there is a uterine bleeding in between menstruation. in between menstruation. So somewhere in between the menstruation. So then also you can write about an ovulatory cycle. An ovulatory cycle. This commonly occurs in the perimenopausal period. So what are the common causes? You can write the common causes as well. So this is very, very important, taken from the Shambhalingam. So you can just go through after the class. So all this you need to write, at least 6, 7 you can write in the exam. Good. That's okay. That's fine. Chalo. Next question. Okay. What is this painful? Pain during the lot of pain. What is that condition known as? All of you can answer. What is this condition known as? Yes, yes. Come on, try. Try. What is this condition? So severe pain during menstruation. What is that condition known as? Try all of you. Let's see who is going to answer. What is the name given to that? Premenstrual syndrome? No, it is not PMS. PMS. What is that known as? You can see here. You can see here. Menstruation with pain. Menstruation with pain. What is that known as? What is that known as? You can see here. This I think you can make out. What is that? Just type that. Nasbatania. Dysmenorrhea. Very good. Dysmenorrhea. Good. This is okay. So the next question is CSF. CSF. Cerebrospinal fluid. So what are the commonly asked question I'm going to tell you. Don't worry. So one is the composition. So one is the composition. What is the composition of CSF? Very commonly asked. Second is functions of CSF. Functions of CSF. And what is the total volume of CSF? What is the site of lumbar puncture? L3, L4. 10. Then you need to write about the clinical applications. So clinical applications. Clinical applications of CSF. Yes. Now let's see. Now all of you go through this. So this is the image that is showing lumbar puncture. Lumbar puncture is normally done between L3 L4. My question is, can you name 1 or 2 conditions where lumbar puncture is done? Lumbar puncture is done. ಯಾವ condition ಗೆ lumbar puncture ಮಾಡ್ತೀವಿ ನಾವು? Where you are going to examine the CSF? Very important. Can you tell me anyone? ಎಲ್ಲಿ ಮಾಡ್ತೀವಿ ನಾವು CSF ಇದನ್ನ? And the flow of CSF, that is also important. The flow of CSF. So lateral ventricle, third ventricle, fourth ventricle, subarachnoid space, sagittal sinus, synthesized by quadrant plexus. Yes, one is meningitis. Very good. So you can write about the meningitis in exam. So write this meningitis. Meningitis. So meningitis can be caused by tuberculosis. So TB. Meningitis can be caused by bacteria. Bacteria. It can be caused by fungus. Fungal meningitis. Viral meningitis. Viral meningitis. So to differentiate between these types of meningitis, so the CSF analysis is very important. This can be asked in biochemistry. So TB, bacteria, fungal and viral. Normally done between L3, L4 because spinal cord ends at the L1 level. So that's why it is L3, L4 or L2, L3. That's also okay. So okay. Then it is also done in case of SAH, subarachnoid hemorrhage. Okay. Confirmation of subarachnoid hemorrhage. So you can do this. Multiple sclerosis, okay. So multiple sclerosis, fine. Other conditions. So then one more important condition is hydrocephalus. In exam, you need to write about the hydrocephalus. Hydrocephalus. So communicating hydrocephalus, non-communicating hydrocephalus. So that is because of the obstruction of the CSF flow. So all these are important. You need to go through this. Then, now look at this. This is basically the flow of CSF. It's very important. So the new students, we just go through this. CSF is produced by quadrant flexus. Quadrant flexus, very commonly asked. From there it goes to lateral ventricle. So from there it goes to lateral ventricle, like this, lateral ventricle. From lateral ventricle it goes to third ventricle. So lateral to third ventricle. Through who? Through foramen of Monro. So this is important one, MCQ. Foramen of Monro. Foramen of Monro. So all of you just write in the chat box. So between lateral ventricle, okay, lateral to lateral Monro. You can remember lateral Monro third. You can remember like this. So all of you write in the chat box. Lateral Monro third. Lateral ventricle, foramen of Monro, and third ventricle. So my favorite, Colin Munro. He was a New Zealand cricketer, very famous cricketer, Colin Munro. So between lateral and third, we have Munro. Then from third to fourth, we have aqueduct of Sylvius. Aqueduct of Sylvius. So from there it goes to fourth ventricle. Fourth ventricle. Then it can go to central canal inferiorly. Central canal in the spinal cord. Or it can go to subarachnoid space. Subarachnoid space. Sub means that is below the arachnoid matter. So through the foramen of Magendie. Through the foramen of Magendie and foramen of Luschka. Foramen of Magendie and foramen of Luschka. So in and this, so by arachnoid villi, so it get absorbed into dural venous sinuses. Dural venous sinuses. So this is very important flowchart, very commonly asked in the exam. Lateral Monro third. Lateral Monro third. Okay, good. This is important. Then you can write in the exam about the, so yes, so okay, that done. Okay. Then what is the composition? So water 99%, solid around 1%. So what are the components? Proteins, amino acids, sugar, cholesterol, urea, uric acid, creatinine, lactic acid, and sodium, calcium, potassium, magnesium, chloride, phosphate, and bicarbonates. So my question is, what happens in TB meningitis? So what happens in TB meningitis? So in TB meningitis, there will be increased protein. Increased proteins. Okay. This is important. And in case of viral meningitis, normal glucose level. Bacterial, there will be decreased blood glucose. Decreased glucose level in the CSF. So that is important. Okay. Then the question can be asked about blood-brain barrier. Blood-brain barrier, I think today the question asked about gap junction. But tomorrow's exam, there can be question about the tight junction. That is basically blood-brain barrier. So blood-brain barrier made up of endothelial cells, pericytes, food process, and all this. Okay. So this is basically tight junction. Okay. So all of you write in the chat box BBB. So BBB is equal to tight junction. Tight junction. Write this in chat box. Write this in chat box. BBB is equal to tight junction. Today question, no, gap junction, right? Good, Charan. Next. Now this image, okay. Again, this is taken from the standard textbook Physiology, Shambulingam, hydrocephalus, okay. So this you can go through after the class. Now look at what is this condition. Can anyone tell me? So large head, because of CSF obstruction. What is this condition known as? Yes, let's see who is going to answer. Come on, guys. Keep answering. I think for RS 5 and 6, not the RS 7, RS 5 and 6. What is this condition? Large head, CSF obstruction because of the tumor or because of the forceps delivery, because of the complications of delivery. So there can be something. What is this known as? Okay, sunset sign. I know what is that? This is hydrocephalus. 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 Great. Okay, now very interesting question. So very interesting question, guys. Visual pathway. Visual pathway. So there is no relation between this visual pathway and this movie. Okay, there is no relation. But just to say the what you are seeing, no, that is the vision. Okay, vision. So visual pathway very important. Have you seen this movie? Have you seen this nice movie recently released in Hindi? So next is visual pathway. Remember visual pathway, lateral geniculate body, LGB, lateral geniculate body. Yes, Malini, ठीक है? Good. Saira, huh? Saira, है ना? Good. So now our question is about the visual pathway, Saira pathway, visual pathway, है ना? Let's see now, Saira pathway. So now all of you try to understand. Our eye is like a camera. The camera has a lens, no? So like that we have the retina is there. So through the lens, the retina, that light that it falls on the retina. In what happens in retina? So ganglion cells. So ganglion cells, they form optic nerve fiber. So basically bipolar cells. Then we have photoreceptors, rod and cones, and we have pigment epithelium. So our vision, our Saira starts with the photoreceptors and all this. Okay. So I think you must be knowing while entering. So while entering, the cinema theater or movie theater or the INOX. So in the beginning you will get some, dark, no. So that's something adaptation, dark adaptation. So this dark adaptation is affected in one clinical condition. Can anyone tell me? So what is that condition known as? Dark adaptation, basically absence of rods because of vitamin A deficiency can lead to a night blindness. What is the vitamin that is involved there? Acha. ठीक है चरण. Charan, okay. What is that condition? A man entering the cinema hall with a girlfriend, unable to see the rose, and he's having a lot of difficulty entering the dark room, dark blindness, night blindness. So what is the vitamin deficiency in that boyfriend? The girlfriend can suspect. Ah, very good. है ना? Vitamin A. Very good, guys. So all of you try to remember direction of the light. Light falls on the retina. Ganglion cells from the optic nerve. From there, bipolar cells, photoreceptor cells, pigment epithelium. Then this is the one part. Second part देखते हैं. What is the second part of Saira? This is the second part of Saira. So this is what you need to write. Cones. So we have cones for the light vision. Then bipolar neurons already we discussed. Ganglion cells already we discussed. Then is optic chiasma. So this is what important. Optic chiasma. So once optic chiasma over, optic tract. Chiasma over, tract now. Then lateral geniculate body, LGB, lateral geniculate body. Medial geniculate body, basically auditory pathway. Don't be confused. So this is the area of confusion. LGB involved in visual pathway, MGB involved in auditory pathway. So all of you write in the chat box, LGB is equal to visual pathway. MGB is equal to auditory pathway. Very important. Auditory, है ना? Hearing, special sense is very important. Auditory pathway, visual pathway, and taste pathway. Then olfactory pathway, very commonly asked. 4 pathways are important. Okay. LGB is equal to visual pathway. MGB is equal to what? That is basically optic. That is basically hearing basically. Then optic radiations. Then primary visual area. Primary visual area present in occipital lobe. So whenever there is a damage to occipital lobe, there can be blindness. So try to understand. Whenever there is a damage to the occipital lobe, like this occipital lobe, there can be blindness. Why? Because the primary visual area present in the LGB. So that is in the primary visual area present in the occipital lobe. Done it is. So all of it done. Can you able to write? Can you able to remember this? Now you need to write one or two visual field defects also. Visual field defects, very commonly asked. Can anyone tell me bitemporal hemianopia? Bitemporal hemianopia occurs due to lesion in. So my question is, let's see who is going to answer. Bitemporal hemianopia. So bitemporal hemianopia. So what is the site of lesion? Yes, Malini answered. Malini, this is bitemporal hemianopia. Okay, central part or lateral part? So this example is optic chiasma. Optic chiasma has a central part and it has a lateral part. So my question is lateral part or central part? Central part. Yes, Syed Abdul. Yes, come on. Syed, come on. Central, very good. So Malini, excellent answer. So Malini answered correctly. He said the central part of the optic chiasma can cause bitemporal hemianopia. Good, great. So yes, this is what you need to write in the exam. So whenever is the optic nerve involvement, so ipsilateral monoocular blindness. So what are the causes? Optic neuritis, optic atrophy, trauma. Optic chiasma central, bitemporal hemianopia. So this is very important. Very important. And very common cause is pituitary adenoma and suprasellar aneurysm. So this can be a clinical based question. A patient is having pituitary tumor, patient is having visual field defect. What is the probable visual field defect? Your answer should be bitemporal hemianopia because of central part of the optic chiasma. So yes, this is very important, central part. Good. Chalo. Next, these two clear. Then comes is your optic chiasma lateral. So in lateral there will be ipsilateral monoocular nasal hemianopia. Nasal hemianopia. So what are the causes? No need to worry about the causes. Optic tract contralateral homonymous hemianopia. Optic radiation contralateral homonymous quadrantopia. Optic radiation. Then optic radiation I said. Optic cortex. So when it is involved contralateral homonymous hemianopia with macula sparing. So this is a bit difficult, but if you write all these points, you will get 4 out of 5. 4 out of 5. When you write visual pathway, you need to write about visual field defects as well. You will get 4 or 4.5 out of 5. Yes, suprasellar aneurysm, pituitary adenoma. Very good. So clear, all of you? Can you able to write optic pathway? Now just remember this, Rahman. Just remember this image, okay? And try to memorize everything. Okay, try to memorize everything. Charan, can you able to write? Say yes or no. Vision, visual pathway. Nazba, okay. Nazba, fine. Aina, Saira. Yes, Rahman. So now you will not forget, I know. Aina? Yes, that's great. That's great, all of you, I guess. Yes, fine. This is okay. Okay. Next comes is auditory pathway. Auditory pathway. Okay. Auditory pathway. You know, auditory pathway is very important. The romantic music, है ना? all sad music, all this because of your ear, because of your middle ear, inner ear, and outer ear collect the sound. Middle ear that transfer the sound into your inner ear. From the inner ear, where it will go. That is what auditory pathway. Hai na? So yes, so good, good. So guys, Charan, what is your favorite song during exam time? So what type of song you prefer in exam time? So yes, I'm very curious about it. So ekdam, okay. Charan, Malini, Rahman, all of you. Nazbat, Ania, what is your favorite song during exam time? ठीक है? Come on, come on. Just 1 or 2 minutes. We'll have some fun. Then we will start. Okay. Hmm. So this can be asked in exam. Hmm. So okay, remember all of you. E. coli ma. The mnemonic is E. coli ma. So auditory pathway 8 now. So 8 now, that is vestibulocochlear now. Then cochlear nuclei. So C for cochlear nuclei. Superior olivary nucleus. Superior olivary nucleus. That is for basically O for olivary nucleus. L for lateral meniscus. Lateral meniscus. I for inferior colliculus. Inferior colliculus. Not superior colliculus. Inferior colliculus. Medial geniculate body and auditory cortex. So mnemonic is E. coli ma. Acha, love failure songs. Okay. Syed, he prefer love failure song. Okay. Charan, what about you? ಒಂದೇ ಒಂದು ಕಣ್ಣ ಬಿಂದು ಜಾರಿದರೆ ನಿನ್ನಾಣೆ. Oh, okay. Very nice. So Malini is telling sir, ಒಂದೇ ಒಂದು ಕಣ್ಣ ಬಿಂದು ಜಾರಿದರೆ ನನ್ನಾಣೆ. Okay. Motivational song. Okay. So Charan is motivational song. Okay. So full. Okay. Fine. Fine. That's okay. Chalo. So all of you write in the auditory pathway is equal to E. coli ma. E. coli ma. So I think very funny mnemonic, okay? Very funny mnemonic because E. coli present in the feces and E. coli ma, I don't know. So some, okay. Chalo, ठीक है. So all of you write auditory pathway is equal to E. coli ma. Write this in the chat box. E. coli ma, okay. What ma? E. coli ma, auditory pathway. What ma? E. coli ma. So है ना, what pa? E pa. So what ma? So E. coli ma, auditory pathway. Auditory pathway means that is the auditory pathway, that is outer ear, inner ear and middle ear. So from the inner ear it goes to all this pathway then to the brain. ठीक है? चलो. Ivanu coli. Okay, that's okay. चलो, now we'll stop. So now taste pathway. This is also important. Okay. Taste pathway. And all of you, I am telling you, go through this taste pathway after the class. So this is also important. And olfactory pathway. So 4 important questions I am just going to write here. So after the class, visual to be discussed already. Visual pathway we know already. Auditory pathway I discussed. Taste pathway. Taste pathway. And taste bud. Taste bud. And one more is there. Auditory pathway, taste bud, and olfactory pathway. Olfactory pathway. So these are very important. Very important. Okay. After the class, just go through this. So go through this. Don't forget. Commonly asked. Chalo, ठीक है. Okay. Taste pathway and all. You just go through that. Next comes is the neuromuscular junction. So all of you guys, very, very important, concentrate. Neuromuscular junction, like this, contraction of biceps, contraction of triceps. So all the contraction of muscles because of the what? Neuromuscular junction. Question is, describe the structure of neuromuscular junction. Structure. Presynaptic, postsynaptic, receptor, axon terminal, neurotransmitter. Yes. Then transmission occur. What are the steps in the transmission? What happens in the steps? Adenota neuromuscular blockers. So what are neuromuscular blockers? So yes, before that, let's see what is the structure. Very simple question, guys. So in exam, you need to write this definition from the Shambhulingam. So then you can write label diagram of neuromuscular junction. You need to write about presynaptic membrane, then mitochondria, synaptic vesicle, synaptic cleft, postsynaptic membrane, subneural cleft, and the muscle. So this is very, very important. Very, very important. Okay. So all of you guys, what is the neurotransmitter? What is the neurotransmitter? Can anyone tell me? What is the neurotransmitter? Come on, guys. What is the neurotransmitter? Yes, Shambulingam, right? What is the neurotransmitter of parasympathetic system? What is the neurotransmitter of parasympathetic system? Acetylcholine, very good. Acetylcholine. So acetylcholine, is a neurotransmitter. It converts into acetate, and choline with the help of enzyme known as acetylcholine esterase enzyme. Esterase enzyme. Okay, so this is also important. Acetylcholine is a very important neurotransmitter of parasympathetic system. Sympathetic system, epinephrine or epinephrine, right? Yes, acetylcholine, good answer. Okay, done. So next comes is this is the one again from the Shambulingam. Just go through this. The pathway of muscle contraction. So starts with the axon terminal, then synaptic cleft, postsynaptic membrane, and muscle fibers, So very, very important. You need to write this. Can you able to write this from Shambulingam? Acha, this question came. Okay. Okay, acetylcholine esterase. Okay, fine. Okay, Shambulingam. Keep writing this. Okay, just go through this, Syed. This is very commonly asked in the exam. Okay. Then what are the neuromuscular blockers? What are neuromuscular blockers? Can I name one neuromuscular blockers? So again, you can see here in the standard textbook, name 4 neuromuscular blocker. One is the Curare. Which is a muscle relaxant. Second one is Bungaro toxin present in the snakes. Remember snakes. Bungaro toxin. Then succinylcholine and carbamylcholine, which is used as anesthetic agent. Botulinum toxin. So Curare, Bungaro toxin, succinylcholine, botulinum. So all of you write. So what are the inhibitors? Just write the name: Curare, Bungaro toxin, succinylcholine, and one more is botulinum toxin. Write this. All these are neuromuscular blockers. So write this in chat box. Snakes, Charan. Snakes, है ना? Nagara how? Bungaro toxin, which causes ptosis, weakness of the facial muscle, respiratory paralysis, and death. Bungaro toxin. ठीक है. चलो. Now I think Syed Rahman, this is the question for you. What is this? This lady, 35-year-old lady, having weakness of muscles here. You can see here, this lady is having ptosis. Lady is having ptosis because of involvement of levator palpebrae superioris, which is nothing but extraocular muscle. So you can see here, this lady is having difficulty. Ptosis is there. Okay. So what is the probable condition I'm discussing? Yes, Syed Rahman, come on. What is the condition? Yes, come on. Ptosis. What is this? So this is actually myasthenia gravis. Myasthenia gravis. So very commonly asked question, myasthenia gravis. And one more condition, Eaton-Lambert syndrome. Okay, Lambert syndrome. Lambert syndrome. So differential diagnosis of myasthenia gravis is Lambert syndrome. So this can be question in your exam. Okay, question in your exam. Yes, so myasthenia gravis, look at this. In myasthenia gravis, there will be antibody against the receptor associated with thymic tumor. In myasthenia, there will be thymus tumor. Weakness worsen on prolonged exercise. On prolonged exercise, okay, there will be weakness of the muscles. Normal deep tendon reflex. Autonomic dysfunction, especially bladder, bowel control, that is normal. Like the opposite. On repeated nerve stimulation, there will be decremental response. Decremental response. Look at this Lambert-Eaton syndrome. It is because of the antibody against calcium channel. This is given in Shambulingam. That's what I'm discussing. Associated with small cell lung cancer. Weakness improves on prolonged exercise. Okay. Weakness increases on prolonged exercise. Deep tendon reflex is absent. Autonomic dysfunction is present. And all this. If you write these differences, myasthenia gravis and Lambert-Eaton syndrome, examiner will be very happy. Very, very happy, guys. So now I feel, guys, and repeated muscle contraction, I am getting some improvement in the muscle tone. So what is that condition? So improvement on increase prolonged exercise. There is an improvement is there. What is that condition known as? Come on, guys, come on. Lambert-Eaton syndrome. Okay, very good. Lambert-Eaton syndrome. Good answer. Chalo. So this is what given in your book. The basics of physiology given in that book. Myasthenia gravis and Eaton-Lambert syndrome. Okay. So just go through this. Just go through this. Chalo. Next. Next comes is very, very important question, guys. Very important. Hypothalamus. Hypothalamus. Okay. All of you guys, how is the Josh? So how is the Josh, my dear students? Are you tired? Are you tired? Or am I boring? Am I boring? Yes, come on, guys. Am I boring? So we're all hardworking students, very hardworking students. You are attending class since last 1.5 hours. 1.5 hours continuously. Okay, no tiredness in the, okay. Hi, very good. The super Josh, sir. Malini is telling, sir. Super Josh. Hypothalamus is there. Hypothalamus, super Josh. No, sir, not tired. Okay. Now, all of you remember, hypothalamus is like a CEO. He is a boss. He's a boss. Okay, all of you remember, hypothalamus is equal to what? You can remember, is the CEO of body homeostasis. CEO. Chief Executive Officer of body homeostasis. So whatever happens in the body, controlled by hypothalamus, he's like a boss. So what are the important function? Homeostasis. Like example, temperature homeostasis, cold, heat. Endocrine function. Endocrine function. Thyrotrophic hormone, TRH. Then autonomic control. Sympathetic, parasympathetic, and drive. So all your emotions, all your reward and motivation, something related to your hypothalamus, controlled by your CEO, nothing but head. Mnemonic is head. So all of you write in the chat box, hypothalamus is equal to boss. He's a boss. and the mnemonic is head. Head is the mnemonic. So write this in chat box, the basic. Come on, hard working lecturer too. Thank you. Yes, thank you, Soumya SM. The passing marks criteria 40, 60, 50, 50. 40, 60, 50, 50. ठीक है? CO is equal to hypothalamus. So he'll control everything in our body. ठीक है? So homeostasis, endocrine, autonomic function and drive, emotion, all this. ठीक है? Motivation also. Now look at this. So suddenly this image came. So see someone is there. So suddenly some tiger comes in between the road, in between in the college campus. What happens actually? Which system is activated? Which system is activated suddenly? That is basically sympathetic system, right? So sympathetic, parasympathetic. Okay. So sympathetic means emergency, fight or flight response. Okay. Then see after holiday, after exam, you will definitely go on a holiday trip. आराम से खाना खाना, आराम से सो जाना, आराम से सब कुछ करना. That is basically the system is parasympathetic. So all of you understood? Sympathetic मतलब क्या है? That is emergency, fight or flight. Parasympathetic मतलब खाना खाना, पानी पीना, सो जाना और बाथरूम जाना. That is actually parasympathetic system. Very simple, I think. Right? Chalo. This is also again controlled by your hypothalamus. That is what your autonomic control. Autonomic मतलब sympathetic and parasympathetic. Hope you understood. ठीक है? ठीक है. Good holiday. चलो. ये हो गया. Now let's see what are the nuclei of the hypothalamus. So all of it, this is what important. So now beginning introduction is over. Now actually the substance. So one important nuclei is paraventricular and supraoptic nuclei. All of you concentrate. This is very important. Paraventricular supraoptic nuclei. What is the function of that? It maintains water balance. It produces ADH. It also produces oxytocin. So the deficiency causes diabetes mellitus. Diabetes insipidus. Not the mellitus, diabetes insipidus. So this is very important. This is central diabetes insipidus. So all of you write in the chat box. Supraoptic is equal to ADH. So let's write the name in the chat box. Supraoptic is equal to ADH. Supraactic optic. Then comes is your anteronucleus. So anteronucleus basically for heat. Okay, anteronucleus for heat. So next all of you write anterior is equal to what? Anteronucleus is equal to heat. Posterior is equal to cold. Posterior is equal to cold. Again MCQ, very commonly asked. So posterior is equal to okay. Preoptic. So preoptic basically gonadotropins. Okay. Preoptic GnRH. Okay. So this is our 4 nuclei. I'll discuss again. Supraoptic ADH. Okay. Anterior heat. Posterior cold. Preoptic GnRH. Write this 4. All the 4 you write in the chat box. Very important, guys. Very important. Yes, good. Charan is answering well. Charan is great. Charan is answering great. Okay. Now comes is your dorsomedial. Dorsomedial basically for the, that is obesity. So stimulation results in obesity. So basically that is for the feeding center. So lateral nucleus causes eating, that is. So ventromedial satiety center. So ventromedial satiety center. Arcuate nucleus produces hypothalamic releasing factors. So mammillary body receive the signals from the hippocampus. Hippocampus. Posterior nucleus already I said. Already I said. So you need to write some 5 or 6 nuclei of hypothalamus. So 5 or 6. So this after the class you can just go through from the Shambhalingam. Now look at this. Now look at this. Now I'm very hungry. I'm taking class since the last 1.5 hours. I'm very hungry. I'm feeling like having some food. My favorite is masala dosa. Now tell me which center which helps in eating. Eating. Come and tell me, guys. Come and tell me. All of you try this. Try to understand. What is the center for eating? Dosa hai, okay. What is the center basically? Nazba is telling, sir, I am also. Okay. My question is, now I'm hungry. My hunger center is there in the hypothalamus. He's the big boss. He is telling, Dr. Saab, aap khana khao. You are tired. मतलब you are hypoglycemia. You are having low glucose level. मतलब कौन सा सेंटर है? डोसा सांबर इडली चटनी चटनी कौन सा सेंटर है बताओ? So Charan, what is the center for hunger? What is the center for feeding? What is the center for satiety? चलो चलो बताओ बताओ. Just go through this now. Now go through this hunger center. Come on, go through this. Come on, go through this. Go through this. Come on. डोसा इडली सांबर चटनी चटनी है ठीक है. Yes, come on, try. Where are you, Rahman? Rahman, are you there? Rahman, which center is for eating? Rahman, you are not there. So this is basically for lateral. So lateral center, lateral center of hypothalamus. So that is basically for, yes, lateral eating. You can remember lateral lassi. Lateral lassi you can remember. Lateral lassi. Okay. Now see after having too many dosas, after having benda dosa, masala dosa, everything, now I am fine. Now I am full. So what is the center for satiety? My question is, what is the center for satiety? What is the center for satiety? No sir, I am full. और कुछ नहीं चाहिए. बस सर, बस. कौन सा सेंटर है बताओ? शायद कौन सा सेंटर है? डोसा खत्म हो गया. ठीक है, डोसा खत्म, इडली खत्म. Satiety ventromedial, very good answer, very good answer. So very good. So you can see here ventromedial. Where is the ventromedial? Ventromedial is for satiety, है ना? Ventromedial satiety. So you can write the mnemonic if you want. So this is what I said. Lateral central lassi and ventromedial, VMN nucleus. So VMN is equal to satiety. That means very happy. Very happy. So these two I think you can remember. Related to my favorite masala dosa. This is how I remember. You can try by your level best also. You can make other mnemonics also. Okay? So this is okay. Hypothalamus, all of you understood? Can you able to write? Can you able to write this nuclei? Say yes or no? Say yes or no, hypothalamus, guys. Hypothalamus. This is okay. This is okay and this is fine. Now one very interesting mnemonic, actually very interesting mnemonic, so which I got from the okay, yes sir, okay. Now this is car. You can remember, you must be knowing anteriorly coolant hota hai na, radiator hota hai, cooling. So anterior senses heat. So finally what it causes? Cooling of the body. And you can see the posterior, that is basically for what? Heating. You can remember anterior for heat, posterior for cold, I said. Ulta you can remember, anteriorly it causes what? When stimulation occurs, cooling. Posterior causes exhaust, basically that is back, that is a posterior side. Then you can see sunroof, suprachiasmatic. That is basically for circadian rhythm. Circadian rhythm. When you see the star, you want to go to sleep. When you see the star, you want to go to sleep. That is circadian rhythm. Laterally, hunger. Hunger, we discussed earlier. Masala dosa, hunger. Medially, satiety. Medially, satiety. I think you can remember 5. You can remember with the help of car. So anteriorly are cooling, posteriorly heating, laterally hunger, medially satiety, sunroof. That is basically circadian rhythm. So this you can remember, very interesting actually, very interesting mnemonic. Is it really helpful, guys? This image, look at this image. Try to memorize, okay? Very interesting actually. Yes, sir. Full sleep, especially terrace. Yeah, that is also correct. Okay, good, good. Charan, are you enjoying the class? Charan. So today I'm going little beyond the time. I wanted to complete at 10:30, but now it is 10:46. So Charan, Malini, Nazba, Lamborghini. Okay, Charan is telling Lamborghini. Okay, Charan is enjoying the class. Charan, you are not sleepy. Great, great, Charan. Great. Where is Shashank? Charan, call Shashank and ask him to attend the class. Charan, call Shashank. Ask him to attend the class because this is a very important topic. Very important topic. That's why. Call Shashank. Sayed, are you there? Okay, till 12. No. Okay, chalo, no problem. I'll try. This is okay. Understood. Next question, the last question of the day, that is the calcium level. Very, very important question. Serum calcium level. So what is normal serum calcium level? 9 to 11 milligram per deciliter. Okay, this is what important MCQ. 9 to 11 milligram per deciliter. So what are the important hormones control the calcium? One is your PTH, parathyroid hormone. So one is your calcitonin. So calcitonin. So one is your vitamin D. Okay, vitamin D. So 3 important things. So what are they? All this, right? Now, so question asked about describe the hormonal regulation. So very simple question. This is again a very important question in biochemistry as well. Second 9 to 11. Yes, you are there. Okay. So this flow chart you must write. Okay. So what happens when there is a low blood calcium level? When it is less than 7, less than 6, there can be tetany. So Chostek sign, Trocheus sign, very common in tetany. So what happens? The signal goes to parathyroid. So that is parathormone secreted by the parathyroid gland, embedded in the thyroid gland. So PTH will act on the bone. It will tell the bone, so we are having less calcium. Take out some calcium from the bone. So from the bone, what happens? So it stimulates osteoclast. What it will do? It will stimulate osteoclast. So bone is reabsorbed and it enters into the bloodstream. So increase serum calcium level. So all have to remember osteoclast. Very important word. Osteoclast. Osteoclasts are basically for bone remodeling. Osteoblasts are basically for what? Bone forming. And osteocytes are bone cells. Okay? Yes. Kidney, what it will do? Kidney will reabsorb the more and more calcium. Then also it causes activation of vitamin D. So vitamin D activation occurs in 2 phases. One in kidney, one in the liver. So activation of vitamin D. So vitamin D causes increased absorption of calcium. So normal calcium level or increased calcium level. So this is very, very important. So low blood calcium level. So the parathyroid acts very well. It acts on the bone. It acts on the kidney. Okay? Okay, that's okay. I have understood, right? Chalo. Next. Now look at this. Look at this image. This is one finding. in case of tetany? My question is very simple. So I'm tapping. So I'm tapping on the facial muscle. So there is a finding there. What is this finding known as? What is this finding? Come on, guys. Come on. What is this? Come on, come on. Try Kirtu, Kerudi. Yes, Chostek sign. Very good. Chostek sign. Good answer. Good, good. So this is known as Chostek sign. Excellent answer. Given by Malini. So Malini, very good. Great. Now we have one more sign. What is this sign? What is this sign? Okay. Very interesting. What is this sign known as? Charan, what is this sign? When you put BP apparatus, BP cuff around the elbow, when you when you increase the pressure more than a diastolic blood pressure, you will see contraction of forearm muscle like this appearance. What is this known as? Chostek sign. Okay. What is this sign? Trosser sign. Okay. Trosser sign. Very good. So Trosser sign. So two signs very important in case of hypocalcemia or in case of tetanus. One is the Chostek sign. The second one is the Trosser sign. This is very important. Okay. Then you can write about the clinical features of hypocalcemia. Hypocalcemia mnemonic is cramps. C for convulsions. C for convulsions. There can be seizures when there is a low calcium level. Reflexes are hyperactive. Reflexes are hyperactive. That is R. A for arrhythmia. So there can be some issues with the heart. Prolonged QT interval. There can be muscle spasm, especially feet, that is tetany. Positive sign, Trosser sign and Chostek sign. Sensation of tingling and numbness, paresthesia. So all of you write in the chat box, hypocalcemia is equal to cramps. Hypocalcemia is equal to cramps. So write this in chat box and try to memorize this. Try to memorize this. Very, very important, guys. Come on, try. Keep writing, everyone. Charan, others. Charan, okay. Cramps. Okay, we'll try subtitles as well. Okay. Okay, so this is about the 10 questions. Now homework for you, all of you guys. 10 more questions are there. So after the class, don't do anything. Just go through all these 10 questions. And these 10 questions is a homework for you. Just revise. Just prepare some notes. Okay. 11th question. Explain dorsal column pathway. So dorsal column pathway. Dorsal column medial lemniscus pathway. So very commonly asked. Dorsal column. DCML. So all of you, this is important. DCML. It is compulsory. After the class, go through this. Very important. DCML. Just type DCML. Go through this. Homework for you. So what are the functions with the label diagram? Label diagram. Basically for the posture, 2-point discrimination and all. Okay, go through this. Then comes is maternal changes during pregnancy. Pregnancy, what are the maternal changes? What are the changes in the heart basically? So heart are serious. So what happens to cardiac output? Increases. What happens to heart rate? So what about the cardiac index, peripheral resistance and all? What are the changes in RS? What are changes in endocrine? Endocrine and all. So this is the important question. Go through this. And functions of placenta. Functions of placenta. 3 mark question as well. 3 marks. So functions of placenta. Okay? Yes, good. This is the 12th question. So go through this. Then properties of synapse. Properties of synapse. Add a note on postsynaptic potential. Again from the standard textbook. So you can refer any textbook. Just prepare some notes. So you can write. We can go through GK Paul if you want. If you are very brilliant, you can go through GK Paul or Genong. So we used to read Genong those days. So but now Shambulingam is there. You can read simple textbook. Simple, okay. People say okay, but okay. Oh, GK Paul if you want you can read, or else you can read Genong also. That's okay. Yes, good. So then, what are the metabolic actions of growth hormone? Endocrine growth hormone, very important. And what is the difference between dwarfism? What is the difference between dwarfism? That is dwarfism. So dwarfism because of the thyroid dwarfism or pituitary dwarfism. Okay. So differences very important. So go through this. This can be a 5 marks question, a 3 marks question. Yes, get on. That's okay. Now again, this is one more question. So that is basically from the reproductive system. A couple married since 5 years, history of not conceiving, comes to the doctor for advice. Male partner underwent semen analysis, female partner also investigated. What are the tests for female partner to confirm ovulation? So can anyone answer this question? Can anyone tell me what is the answer for this? What are the tests for ovulation? What are the tests for ovulation? Then what are the criteria? What are the components of normal semen analysis? What do you mean by oligospermia? What do you mean by azoospermia? What is normal motility of the sperm? What is normal ratio of shape of the sperm and all? You can just go through that. So in the after the class, okay, this is important. Then this 5 important question: label diagram of taste bud. Taste bud. Can anyone tell me what is the important cell of taste bud? One cell of taste bud. Ultrasonography, okay. Yes, Charan. Taste bud alli one cell barutade. Yav cell adu? 1, 2, 3, 4 alla. One more cell is there, no? What is that, Charan? Can you name the cell in that taste bud? Then comes the pain suppression pathway. Pain pathway important and pain suppression pathway. Both are important. Organ of Corti, hair cells, inner hair cells, outer hair cells. So that is inner ear for the auditory pathway. Formation, drainage of aqueous humor. So formation and drainage of aqueous humor. So basically that is eye. So anterior chamber, posterior chamber, Clem's canal, trabecular meshwork, all this important. Glaucoma. So what do you mean by open angle glaucoma, closed angle glaucoma, acute congestive glaucoma, and normotensive glaucoma. So and all you can write few points about the glaucoma. This is very important. Very important. And slow and fast muscle fibers. Slow and fast muscle fibers. So these 20 questions you need to complete at any cost. Not gustatory cell, sustentacular cell. Okay. So this 20, just go through next 1 hour, 1.5 hours, just go through these 20 questions. So now it is around 11 o'clock. So by 1 o'clock, you need to complete all these 20 topics. So just write it in the paper and you can revise just last day. Last day, you can just revise. So after 12 o'clock, you can read whatever you want, system wise or topic wise or question paper wise or paper wise, or it is previous RS3, RS4 questions wise you can read. But these 20, just compulsorily go through this. Yes, so this completes your today's session. So almost 2 hours now. 2 hours to complete the 20 questions. Thank you all. Thank you for your patience. I hope you enjoyed the class. So Nazma, Tanya, sustentacular cells. Yes, good. Thank you all. So So any doubt regarding preparation now? Any general doubt for next 5-10 minutes? I'm there here. You can just ask me if you want. Next 5-10 minutes. Tomorrow we'll have discussion about UMN, LMN and all. So next 20 questions we have. So around 40 questions I'm planning. So 20 today over. So tomorrow around 20. Okay. Now any general doubt? Nazba? Syed? Okay, you enjoyed. Okay, Rahman. Good. Good. Weightage. Yeah. So weightage tomorrow I'm going to discuss. Okay. Tomorrow at 9 p.m. the class is there. So we'll have discussion at 9 p.m. tomorrow, along with 20 more questions and some interesting mnemonics, interesting clinical based questions, and some fun in between. We'll have discussion. That is tomorrow. No doubt. Okay. So that's okay. See you then tomorrow at 9 p.m.